Fear is a thought, let it go. Fear is indeed a thought or an emotion that arises from certain perceived threats or dangers. It is a natural response that helps us identify potential risks and avoid harm. However, sometimes fear can become excessive and irrational, leading to anxiety and stress. While it may not always be possible to completely let go of fear, we can learn to manage it and reduce its impact on our lives. This can be done through various techniques such as mindfulness, relaxation, cognitive behavioral therapy, exposure therapy, and more. It's important to acknowledge and accept our fears, but we shouldn't allow them to control us. We can learn to face our fears with courage and resilience, and ultimately, overcome them. Manifestations of fear. Fear can manifest in a variety of ways, both physically and emotionally. Here are some common manifestations of fear. Physical symptoms. Fear can trigger a fight or flight response in the body, which can lead to physical symptoms such as sweating, trembling, increased heart rate, rapid breathing, and muscle tension. Avoidance behaviors. When we are afraid of something, we may try to avoid it altogether. This can manifest as avoiding certain people, places, or situations that trigger our fear. Anxiety and worry. Fear can also lead to anxiety and worry, as we imagine all the possible negative outcomes of a situation. Irrational thoughts. Sometimes fear can cause us to think irrationally or jump to conclusions, assuming the worst-case scenario without considering other possibilities. Panic attacks. In some cases, fear can lead to panic attacks, which are sudden, intense episodes of fear or anxiety that can cause symptoms such as chest pain, shortness of breath, dizziness, and nausea. Behavioral changes. Fear can also cause us to behave differently, such as becoming more withdrawn, defensive, or aggressive. It's important to recognize and address these manifestations of fear in order to manage it effectively and prevent it from interfering with our daily lives. Causes of fear. Fear can have many different causes and can be triggered by a variety of factors, including past experiences. Traumatic events or negative experiences in the past can create a fear response that can be triggered by similar situations in the future. Genetics. Some researchers believe that there may be a genetic component to fear, as certain people may be more prone to anxiety or fear-based responses. Brain chemistry. Fear can also be influenced by imbalances in brain chemicals such as serotonin or dopamine. Learned behavior. Fear can be learned through observation, such as seeing someone else experience fear in a particular situation, or through conditioning, such as associating a particular stimulus with a negative experience. Perception of threat. Fear can be triggered by a perceived threat or danger, even if there is no real danger present. Lack of control. Feeling a lack of control over a situation or outcome can also trigger fear, as we may worry about what will happen if things don't go as planned. Cultural factors. Cultural beliefs and values can also influence what we fear and how we respond to it. It's important to understand the underlying causes of our fears in order to address them effectively and learn to manage them in a healthy way. This may involve working with a therapist or counselor, practicing relaxation techniques, or developing coping strategies to help us deal with our fears when they arise. Harmful effects of fear in our lives. While fear can serve a protective function by alerting us to potential threats, it can also have harmful effects on our lives, including anxiety and stress. Fear can cause chronic stress and anxiety, which can have negative effects on our mental and physical health. Avoidance behaviors. Fear can lead us to avoid certain people, places, or situations, which can limit our opportunities and prevent us from living life to the fullest. Isolation and loneliness. Fear can cause us to withdraw from social situations, leading to feelings of loneliness and isolation. Depression. Chronic fear and anxiety can lead to depression, which can impact our quality of life and ability to function effectively. Physical health problems. Fear can cause physical symptoms such as muscle tension, headaches, and digestive problems, and chronic stress can increase the risk of health problems such as heart disease and stroke. Impaired decision-making. Fear can impair our ability to make rational decisions, leading to poor choices and negative outcomes. Limiting beliefs. Fear can lead to limiting beliefs about ourselves and the world around us, preventing us from realizing our full potential. It's important to learn how to manage our fears in a healthy way in order to prevent these harmful effects and live a fulfilling life. This may involve developing coping strategies, seeking professional help, or challenging our limiting beliefs about ourselves and the world. Simple and easy solutions to overcome fear in every form in our daily lives. While overcoming fear can be a complex and challenging process, there are some simple and easy solutions that can help manage fear in our daily lives. Here are a few examples. Practice mindfulness. Mindfulness techniques such as deep breathing, meditation, and body scanning can help you stay present in the moment and reduce anxiety and stress. Challenge negative thoughts. When you notice yourself having negative or fearful thoughts, try to challenge them with positive and rational ones. Ask yourself whether your fears are based on reality or whether they are irrational. Take small steps. If you are afraid of something, try taking small steps towards it instead of avoiding it altogether. This can help build your confidence and reduce your fear over time. Seek support. Talking to a trusted friend or family member, or seeking professional help from a therapist or counselor, can provide emotional support and practical guidance for managing fear. Face your fears. One of the most effective ways to overcome fear is to face it directly. Try gradually exposing yourself to the things you fear in a safe and controlled way. Focus on positive outcomes. Instead of focusing on what could go wrong, try to focus on positive outcomes and how you can achieve them. This can help shift your mindset from fear to motivation. Engage in self-care. Practicing good self-care habits such as getting enough sleep, exercise, and healthy eating can help reduce stress and anxiety, making it easier to manage fear. Remember that overcoming fear is a process, and it's okay to take things one step at a time. By practicing these simple and easy solutions, you can start to manage fear in your daily life and build a more positive and fulfilling future. Summarize the message. The message is that fear can have harmful effects on our lives, but there are simple and easy solutions that can help manage it. Our Feel Good webinars provide practical and simple ways to overcome fear, lack of confidence, frustration, impatience and restlessness in our daily lives.